Good morning and welcome to Super Healthy Super Mornings with Dr. Shilpi. Today I wanted to talk something different uh, and the other side of natural birthing. Every time it is not the same situation, and obstetrics is all about different things and different variations, and whenever we call obstetrics as it is having lot of variations, definitely we will have lots of interventions also. So when it comes to interventions for obstetrics also, for the process of delivery, for the process of assisting the mother, for the process of enabling the process of labor to happen smoothly, and also achieve normal delivery, we have certain interventions that we do to improve the outcomes, and also to look into any emergency situations, or when the delivery is not progressing, or when the mother is getting tired, or special situations. So, natural birthing is one aspect of giving a vaginal delivery, and interventions are another aspect of giving a vaginal delivery. For me, if you ask me, in every given situation, natural birthing per se is not possible. It can be because of various reasons, and women do get tired, women do need some kind of an assistance, and at times, medically also it is required. And in such aspects, and there is another very important thing, that pain can change many people's mind and motives and determination. So under the influence of pain, uh, if they are not getting distracted from pain, or they are not able to accept that kind of pain, or if they feel that they should be supported in this aspect, the interventions come in. So I'm going to talk basically about 4 interventions, and that is uh, first one is the epidural, the second one is the episiotomy, the third one is the vacuum, and the fourth one is the forceps. So basically we've got 4 interventions. And when we have to talk about interventions in labor and delivery, people do widely ask about epidurals, and epidural is one form of giving pain relief and relaxation to the woman in labor, and it always does not work. Okay, there is some power above the level of the brain also. Certain people are so much apprehensive in pregnancy and so much apprehensive in labor. Even after giving epidural, they are not happy. They think that epidural is some kind of a wonder. I can say to an extent it is some kind of wonder, but if you have your emotional health under your control, if you're emotionally unstable, and if you are worrying, and if you are all over the place, and if you say that it is pain, epidural also will not be able to give you that kind of a relief, and it for surely cuts down on the pain component, but there is certain amount of pressure that people also perceive it as pain during labor and delivery. So whenever there is a contraction, they feel that feel the pressure of the baby, or the pressure of the uterus contracting as pain. So for them, it is only half the solution that we can give them. But then yes, for somebody who is very particular that pain is an aspect that is going to bother them, and they still have a control over their emotions, and still are looking for some grade of pain relief, and are okay with the pressure sensation, yes, epidural does work very well, and the process of labor also accelerates faster, because I usually, even if a range of anesthetists that we have in our hospital. We have about 10 to 12 of them, and everybody is so much into epidurals and anesthesias and high risk anesthesia and all these things. But yet I want women to have natural birthing without any kind of an epidural, a conscious birthing with the help of with the support of the partner. And it's definitely partner and family support that gives that kind of an emotional bonding and support during labor and delivery. Yes, but if the labor is not progressing because of an inhibition of pain, or if there is something that is working beyond her capacity, definitely I opt for an epidural. And once we give an epidural and just put the woman to relax and maintain sufficient contraction, we have walking epidurals, not an issue. We don't have to put the woman to complete bed rest. We have walking epidurals, and in walking epidurals you can do your exercises, somebody supporting you. You can do your squats, you can do your ball exercises, you can even dance, you can even do your leg exercises. You can experiment, and it is not a problem at all. And your freedom of mobility will not be restricted unless and until you're very close to labor and delivery. And epidurals do work in that context, and there are very few people who, for me, I feel that they are an ideal candidate for epidural, or if they're not progressing, they can switch into that procedure. And it is very useful procedure as a backup for me. And usually whenever I take women into labor, 90%, 95% of them, they end up having labor and delivery without any epidural. But epidural is a definitive option that if they really want, they have their own birth plans, they have their own plans for the delivery, what should be done, what should not be done, how are they expected to be taken care, all these things, there is a birth plan. So whenever we discuss things, if they are particular about epidural, I always tell them epidural option can be taken at any given point of time. Even midnight we have got the anesthetist on the floor in the hospital, so not an issue. But natural birthing is another aspect that you should really think about, and it's all in between the partners that they take it forward. And about epidural, it is a minimally invasive procedure wherein in the space of the epidural, in the space of the spinal canal, between the bony structure and the spinal cord, there is a space, that is the epidural space, wherein they insert a catheter there, and through that catheter they deliver certain amount of anesthesia drugs which will numb the sensation of pain, and the sensation of pressure is intact, and the sensation of touch is also intact. It is only the pain sensations that they block, and this can last for a very long time, even after labor and delivery is completed, for pain relief of the if any needed, that you can continue that epidural catheter for a day or so. And epidurals are very beneficial for somebody who is looking really into pain relief, and they even cut down on the apprehension aspect also. Women feel that now that something is done, they will progress, and that is how they progress very smoothly once the epidural catheter is on. And epidural is a real choice that they can take. And coming about episiotomy, there is so much of a notion about episiotomy. There are certain women that they're very particular in their birth plan. They say no episiotomy. That is also a welcome. And episiotomy is only given to protect the perineal muscles, the muscles around the vagina and the muscles around the anal canal, so that a haphazard tear does not happen when the baby is coming. But good amount of perineal massages and taking care of the perineum, and at times even water birthing, you can have a very well prepared perineum, and good amount of perineal support if we can give the woman, definitely perineum can be saved. And at times the baby is bigger in size. Nowadays we know how much the baby is anticipated, and if the baby is bigger in size, then the chances of having a bigger tear if we don't support with an episiotomy is there. So in such given situations, we are bound to give an episiotomy with the consent of the woman. And for somebody who's not very particular about any birth plan, who are not very particular about any aspect of giving an opinion about episiotomy, we take a call, and if necessary only we give an episiotomy, especially to support and the right direction of incision, so that the repair is easily possible. And episiotomies, in certain communities and in certain religions, episiotomies are not welcome. So we do take respect of that point, and we do not give them episiotomy at all. And if in case there is a tear, we repair the tear accordingly how much the tear has happened. And even in Lama's classes, the childbirth education classes and antenatal classes, when people go ahead for education of both the partners, they are in particularly wanting the most natural birth as possible, as much as possible. So even for them, having episiotomy is another kind of intervention. So they don't want intervention. So for them also, we take it into a consideration that if the baby's weight is everything normal and there is no problem, definitely she can go ahead without having an episiotomy. But episiotomies are generally given to protect the perineum and the tissues around the vagina, so that a particular kind of an incision can be repaired easily rather than a tear here and there. And there are situations where women do not accept suturing of any tears also, so that is also acceptable. And it is according to their beliefs that a labor has to be conducted, because it is the choice of the woman and it is not the choice of anybody else. And when they are determined and conscious decisions that they take, medical interventions and advice can be given right time at the right place. But if the whole aspect of the woman's body, she has control over it, and if her decisions are to be followed, yes, her decisions have to be followed, because it is ultimately it is her body, and as a medical specialist you have to take care of her emotions also. And that is also in place. And episiotomies are given whenever there is delay, or at times medically episiotomies are necessary whenever the baby is going into distress, or the heartbeat is dropping and the woman is not adequately pushing, or when the pediatric indications come in. Definitely episiotomies do come in, and other interventions like vacuum and forceps also come in. So there are two different things that we need to talk about. One is the pediatric angle, the baby angle, and one is the mother angle. As far as the baby angle is going good, anything and everything that the mother requests would be taken care of. But when there is heartbeat variations and the baby angle is taking a different turn, then definitely we need to look into the outcomes of the baby, and we need to accelerate and we need to intervene in terms of some kind of an intervention for the woman, because further delays can give problems to the baby also. So in such situations we do counsel about these special situations, that the baby heartbeat is dropping, or the baby is you're not able to push that adequately. So should we help you with forceps or a vacuum? In vacuum, there is a cup that fits onto the baby's head, and with the cup that fixes onto the baby's head, we create a vacuum inside the cup so that it holds the baby's head in a particular fashion. And when the mother is not able to push, or when the rotation has to happen, or when a particular event wherein the baby is just to deliver but the delivery is not happening, then we put a proper applicator with a properly locked vacuum, and then we assist and slowly pull the baby's head outside so that the delivery happens smoothly. in a similar fashion, instead of a cup, we have two blades that have space inside them, and the two blades are just locked into the baby's head on both sides, and we put pressure and deliver the baby in such a way that the safety is also there and the delivery also happens. So these two processes, like forceps and vacuum, they are done under consent of the woman, and they are usually done when the woman is exhausted or a full dilatation has happened, the head is on the perineum, and the delivery is not finishing, and there are some other indications like the baby's heartbeat dropping, or she is not able to push, or any other special situations. We need to use these things. And at times, when you have forceps on vacuum applied, we need to give an episiotomy also to assist it, and that consent is also taken. And whenever these kind of procedures are done, so the urinary bladder should be empty, and the woman should be conscious, and the family should be informed, and it's a conscious decision, and the pediatrician should also be informed about any variations in the heartbeat. So that is very, very important. And forceps and vacuum usually are done when there is extremely fatigued mother on the other side, and there's a delay that is happening in delivery, or the baby's head must be a little bigger than anything. Both situations, it is only the head presentations that we can do these procedures, and no other presentation we can do these procedures. It is only in head presentations that we contemplate normal delivery with vacuum and forceps. And there should be some kind of a technicality aspect training that has to be gone through, even for the obstetricians, to do these kind of procedures. In the recent situation, the newcomers and new obstetricians are not very well versed with these procedures because of inadequate training. So usually whenever who is doing such procedures, they do come and assist and see and all that. So vacuum and forceps is also one of the method. It's a kind of boon to the delivering mothers whenever there is an obstruction, or whenever there is any non-progress that is happening. So epidurals, episiotomy, vacuum, forceps, all these interventions are there, but they do not come in the way of natural birthing. Natural birthing is definitely important, because when it comes to a normal scenario, natural birthing is an aspect that we need to promote. Partner support is something that we need to promote to encourage natural birthing. Any situation which is getting deviated or which is getting delayed, these kind of interventions come in. And it is always advisable that you need to be in somebody's hand who are adequately trained in this, where you have a support, just in case if you need any support, they are available to support you. So it is very, very important that all kinds of trained and equipped places are safe for delivery. That is why even places where they encourage natural birthing, high risk pregnancies also need these kind of assisted procedures, and you should make sure that a backup is always there, just in case if you need it. Because once you go into labor and delivery, only then your determination level is known to us and known to you also, because labor and delivery changes many perspectives of many people. So a backup procedure should be there, just in case if you need it, and just in case we require to intervene for the special situation that is there. So this is all about epidurals, episiotomy, vacuum, forceps, and there are good things about procedures, there are bad things about procedures, but whenever you need to do it, you should always look into the good that is there. Anything that happens bad in terms of little more of blood loss, a little more of an incision, or a little more of repair, or any other small issues, would definitely not matter more than a pregnant woman's life or the delivering baby's well-being and health. So medical procedures and medical interventions are there only for special situations, given a chance that to save the mother and the child. And you should be very well aware of these things and make conscious decisions. Natural birthing is an aspect that we should look forward for minimalistic interventions in pregnancy. But then at the back end, just in case if you need anything, you should be ready for it. So this is all about interventions today. It is all about sophisticated things like epidurals and convenient things like episiotomy, vacuum, forceps, and anything and everything about achieving normal delivery and normal health, back to life early, for all pregnant and delivering mothers. So catch you another topic tomorrow morning, and see you at 7:30 Super Healthy Super Mornings with Dr. Shilpi. Bye bye.